This is In Other Words. My name is Herb White. I'm editor-in-chief at the Charlotte Post. And the big, beautiful bill is now law. It was signed by President Donald Trump on July 4, and it has many different aspects to it. But today, the subject that we're talking about is health insurance. And with me to make some sense of this is Joyce Palmer, who is founder, owner of JP Financial Group, LLC in Charlotte. Welcome to the podcast, Joyce.
Thank you,
Yeah,
Herb.
you've got a lot of stuff to talk about because
Yep.
even among lawmakers, they don't even know what's in this law now. So,
Right.
as a financial services expert, you can help walk us through what is one of the most important parts of it, I think, with a lot of Americans, is healthcare. Uh,
Mhm.
Federal programs like Medicaid, Medicare are impacted. And I would also imagine that the way that you get private insurance through the Affordable Care Act is
Mhm.
also impacted.
Yeah.
So that would be my first question. What's in this bill or law, and how does it affect how Americans will access health insurance moving forward?
Yeah. So you're right. It is a big bill. I won't say it's beautiful, but it is big. As it pertains to healthcare, we can expect everything that we know and understand about the healthcare world right now to change, right? The landscape will be affected across the board, not just Medicaid, where the biggest cuts are coming from, but the healthcare marketplace, the Affordable Care Act is being chopped up as well. It's going to be affecting people that are under 65. And then it's also going to spill over to everyone as far as healthcare costs is concerned, because a lot of the costs will transfer and trickle down to private pay um, insurance. So no one will get around not being affected by it. So we're looking at 9.1 million people will projected to be uninsured by 2034. Um, that's what they're saying is going to be a huge federal cut as far as saving money. But the question is at what cost, right? So the bill is further going to impact the state of North Carolina. I think we're looking at hundreds of thousands of people that will be losing health insurance coverage. It's taking a step backwards in that we just got the North Carolina expansion of Medicaid for North Carolina. We fought so hard to get that. And so that will practically be reversed. So yeah, it's going to be a big, huge cut across the board.
Talk about the cuts and how it impacts North Carolina, and you mentioned the expansion of
Mhm.
Medicaid uh, eligibility. I think it
Right.
saw the figure, it was like 650,000 North Carolinians were
Mhm.
made eligible for coverage just in the last year.
Yes.
That was a bill that was signed into law
Hmm.
just before Roy Cooper left office.
Right.
And it also entails a clawback, where if the federal government decreased its share of the coverage, North
Hmm.
Carolina would correspondingly
Right.
cut money off as well.
Yeah.
So that may be the obvious way of explaining that, but can you explain that a little bit further in terms of
Yeah.
how that may
Yeah.
impact people?
Yeah. So the first part of it is the Medicaid expansion. They're adding additional requirements in order to even be eligible for Medicaid. They're adding the work requirement. So if you're a non-disabled adult between the ages of 19 and 64, you've got to work 80 hours or take some form of education or schooling or something in order to keep your Medicaid. So that's going to affect probably just nationally about millions. Probably, I think the number was 4.8 million. They expect to basically not be able to enroll or get disenrolled because of that. The frequency of checks, that they're that the that they check on to make sure you're continuously eligible for Medicaid. Right now, they do it annually, so they're going to increase that to every 6 months. And the whole idea is to make it more difficult, right, for you to maintain the coverage. They're going to have some address verification process that you're going to have to go through to verify your address and if you move frequently. So really just adding extra layers of qualifying for Medicaid. And then, of course, like I said, taking people off of Medicaid. The matching contributions, which you mentioned, the federal matching contributions to help people that are getting coverage, they're going to discontinue that or reduce it for matching contributions. Therefore, states like North Carolina that has the expansion would not be able to get that matching dollar, which means they're going to have to pull back on their enrollment. They're going to limit services. This one is still trying to be determined, but a lot of the medical procedures that kind of came across, like things for women's health, for an example, is being impacted greatly. Facilities that provide women's care or women's services like that, if they were getting funds from Medicaid, they're not going to be able to get those funds anymore, even for the non-abortion type procedures. So that just means if they do anything, they're not going to get any funding at all. They're going to probably take out this anything that deals with transgender health procedures. That's going to go away. And then there'll be additional tax restrictions and payment caps on what the hospital puts out there as far as capping your cost. That's going to be affected. So Medicaid obviously is hit the hardest. But again, like I said, that's all going to spill over to the other areas for people that are paying. You're going to see rural hospitals, for an example, closing down because a large portion of their funding is coming from Medicaid.
And so the poor, low income folks,
Yeah,
that is in the rural
right. The
residents,
rural
North
areas,
Carolina.
right.
Those are the folks who will get hit hardest.
They'll get hit directly, right? But what I share with people is that it's a domino effect. Somewhere, somehow that cost has to be made up. So what you're going to see is, we're already seeing it with insurance companies, private pay. You're going to see your premiums go up. You're going to see more things not covered under the private insurance payers, because they're going to have to make up the funding they're losing from the federal government. So in order to do that and keep their doors open, they're just going to charge private fee insurance persons more. So,
and if you are employed by a major corporation, what's the difference between if you worked for, let's say, a Bank of America or Duke Energy, and you worked at a smaller place that has maybe less than 20 employees?
mm-hmm.
Difference between working at the corporation and getting health insurance and working for a smaller company?
Yeah, yeah. So the smaller companies will definitely not be able to sustain a lot of the cuts and expenses because they don't have the large pool of people to help keep the cost down. So now that cost has got to be spread among the few people if they're, going to take any increases. So the large corporations, they can leverage a little better because they have the law of large numbers. They have more people. They can spread the cost around. The smaller companies are not going to be able to do that. So again, you're going to see, your costs go up for normal healthcare costs. Your premiums are going to go up. Your choices of plans you can choose from. Some carriers will probably choose to pull out of some states and not even offer coverage anymore. The 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 ACA or the Affordable Care Act in the marketplace is going to get hit really hard because and this is something that's actually going to go in effect as early as November when we start open enrollment for 2026. The open enrollment period normally was going from like November to January to open enroll for your health insurance, where they're going to take that and reduce it to 45 days. So now you've got 45 days literally to get your health insurance renewed for 2026. And that I think is going to be huge because most people are not going to even recognize that until it's almost that time, because we're talking not next enrollment period, but this enrollment period.
Yeah. And so what would happen if you missed that window? You're just
Then
out.
you have no coverage because this special enrollment period, that's the other thing. They're taking away the special enrollment period. So where before, if you didn't get during that time period, you had another window of opportunity to get a special enrollment done. Based on your circumstances. Well, they're going to minimize the special enrollment period. So that's going to be shortened as well. And they're going to take out a lot of the reasons where you could do a special enrollment. It's going to be limited to something like you just lost coverage or you moved to a new location. So a lot of the special enrollment provisions will go away. And like I said, you got 45 days to get enrolled. And then they're going to eliminate, like I said, the special enrollment period for individuals where their income falls below a certain level.
That sounds like it's going to put a lot of stress on the folks who shepherd this process for
Yeah,
people who are using the ACA.
correct. Correct. Yes. As an agent, a health insurance agent, since Affordable Care came in existence, we've helped thousands of people get enrolled during health insurance enrollment period. And of course, the first years it was really crazy because it was new. In the last couple of years, we have been able to streamline the process, send out notifications to people, make sure they get their updated documents in and get their renewals done. But that was during a time period where we had 2.5 months. At first it started out 6 months, then it went down to 2.5 months, and now it's going to go to 45 days. There's no way to get that done and keep the same number of people enrolled. So people will automatically not get re-enrolled because there just won't be enough time to get them processed.
Sounds like it's going to be a lot of chaos later in the year.
Yeah, 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 yeah.
In terms of since the law has been changed earlier this year, or earlier this month, what are people telling you, whether it's clients or just interested bystanders, in terms of the questions that they ask, if they're asking, what does it mean to me, or what do I do now? What do you tell folks?
That's a good one. First, I think a lot of people are not yet paying attention enough. I think the first thing is so much is happening so fast. And like I said, this is just one facet of the big, beautiful bill. There's a lot of other things, taxes, and then there's all the other things the administration has going on that it's hard sometimes to know where to focus and where to put your energy to pay attention to. So the first thing I share with people is do your due diligence, pay attention, listen to things like the podcast, read, and seek out information. The more knowledge, the more understanding you have, the more you hear about it, the better equipped you're going to be able to respond to it. And then the next piece is I'm getting a lot of um, how will this affect me personally if I'm not on Medicaid, or if I am on Medicaid, or if I live in a rural area, or if I have the Affordable Care Act, how will it affect me personally? And that's where we've got to get out and educate. We got to get out and offer assistance. We all hands on deck. Everybody's got to do their part to make sure we protect those that are most vulnerable, like the lower income, some of the seniors that's going to be affected by this that are in facilities or participating in assisted living or nursing homes, things like that. The healthcare community, healthcare workers, they're a good source to go to because they're going to be affected by this as well. So it's all hands on deck. Is everybody paying attention and um, seeking information, sharing it with other people, spreading the word, letting them know that we do have to move fast on this as well. We can't wait. Some of these things are taking place literally, like I said, as early as November.
Part of this, I get the impression, because the window for signing up for insurance through the ACA, that window is so narrow now. Do you fear that it would have a knock-on effect of just basically scaring people away in terms of, that window is so narrow, I got to go look up my tax information
Mm-hmm.
and all the other things that go into filing for the renewal, that some people say, you know what, forget it.
Mm-hmm.
I'll
Yep.
go without like I had
Yep.
before.
Yep. Yep. Unfortunately, that very well may happen. By the window being much narrower, um, there are a lot of people that will go without insurance. And that that's where um, we'll see loss of lives. We'll see people lose their lives because healthcare is one of those things that we fought so hard to get for everybody, and everyone should have good health care. But if you don't have insurance, then most likely when you're sick, you're not going to go to the doctor or the hospital because you don't have insurance. And now, people will let their health be compromised because of that.
You also talked about the domino effect. When people don't have health insurance, if they get sick or hurt,
Mm-hmm.
usually that means a trip to emergency rooms.
Right. Yeah.
And
Yeah.
ultimately, people who do have insurance
We'll
wind
pick
up
up the
paying
costs.
that. Uh,
Right.
so talk about the societal cost, and that, not suggesting that you are an expert on what will happen to hospitals,
Mm-hmm.
but
Mm-hmm.
what is the add-on impact of people who will wind up with insurance in 2026 and beyond? What will be the impact on them?
Yeah. So like I said, the people that have insurance, now when you go, you're gonna definitely see an increased cost in your plans. Um, Enrollment will go down with the Affordable Care Act. Uh, Even with Medicare, it's not directly being affected, but I think we're gonna see with Medicare, some carriers pull out of the state as far as their plans. Prescription costs is getting ready to go back up. That was one of the provisions that we fought so hard to get, especially things like diabetes and insulin. All of those were some initiatives that were put in place to help reduce the cost of medicine. We're going to see that cost go back up. So again, um, and we're going to probably see on the private insurance side, like things like long-term care insurance, which is for individuals who have resources and are not going to be eligible for Medicaid. They need to have long-term care insurance. We're already seeing some indications that insurers are going to be much more strict on their underwriting for long-term care, which means that someone who has resources may not be able to get a decent long-term care insurance policy because of what's happening to Medicaid.
That's a lot to that's in. Really, it is. How will this impact the strategy that you use with the insurance
Mhm.
uh, being established or reestablished from year to year? Uh, do you have like a checklist that previously you encourage people to do their homework and due diligence before they sign up? And what will that checklist look like now that there's all these changes going on? So if I walk up to you and I'm a first time customer, what are
Right.
you telling me to do?
Yeah, well, in researching and preparing for the podcast, Herb, is when I really realized that that enrollment period was being cut to 45 days. So literally in the last week, we've kind of gone back to our processes to implement something to start some early notifications as early as the end of this month to say, look, we know you have health insurance now through the marketplace. We are now aware that the enrollment period has been shortened to 45 days, which means we need to get updated information now and start the process, get everything lined up, know what your income, because it's based on your income and your tax filing status. Make sure you file your taxes, you have documentation to that, because that's going to be part of what you need to get re-enrolled. So the first thing we're doing is we're literally starting our pre-enrollment process early, whereas normally we would start it like in September for November 1. It's starting November 1. We're going to start that now. We're pushing to get something out there in part of this month to start it. The other thing is with Medicare is same thing. Encouraging everyone to have a Medicare review done. And again, that's all going to start earlier. Medicare open enrollment starts in October. Normally, we don't even start talking about it until September. That too needs to start early. The earlier we can determine what the person's eligibility is going to look like, or if they're going to need additional documents, or if they're going to need to change their plan because maybe the medications or the prescription has changed, the better equipped we'll be to be able to get more done in that short window of time.
So
Yeah.
everything's moving up.
Everything's moving up.
Prepare yourself moving forward. So
Mhm.
it sounds like the basic, you know.
Yep.
Okay.
Yeah. Yeah. So we'll be doing our workshops and our webinars and sending out email blasts. So that's something that individuals can do is they can stay alert to receive information, keep their emails open, keep their ears open to find out where they can go to get help and how soon they can start, submitting their applications, have their, like I said, all the documentation as much as possible ready, because they're now going to probably ask for more documentation than they have in the past. And they're going to give you a shorter time period to get the documentation in before you lose your coverage.
It sounds like, if you're of a certain mindset, this sounds like a lot of doom and gloom. But is there anything that you can find, whether in the law or just from your own experience, that would give you encouragement that this is going to be okay ultimately?
Is there hope? Okay. Well, there's always, I'm optimistic. I'm always hopeful. Um, there is, to be honest, not a lot things I can be optimistic about, especially not pertaining to the health insurance side of the bill. Like I said in the beginning, the bill does cover a lot of other areas. There are some tax opportunities, I believe, that we can be positive about or feel encouraged about. But again, you've got to understand exactly where you fall in that, your guidelines. So with the health insurance side, I'm really hard to find the positive. I really, only because, like I said, even if you're not Medicaid or you're not the Affordable Care Act, you can expect to be impacted because the cost will trickle down. The only positive is that it may cause people to be a little bit more aware and alert, and now force us to do our due diligence earlier versus waiting and thinking, okay, I can always pick it up later, or I'll wait till, December 15th to get my enrollment done because I have another 30 days or whatever. It may cause us to move with a little bit more urgency. But that's the only positive I feel on the health insurance side. Like I said, the other things, I think there are some opportunities for doing some of the planning and strategizing, especially as it pertains to the taxes. I think there are some opportunities that we could take advantage of on the tax side of this bill.
Okay, good enough. And before we go, tell folks where they can go to get up to speed or have their questions answered about this, because I know these few minutes isn't enough. If you have questions, you need to go to an expert. Where's the expert? Tell us where you can be located.
Sure. So JP Financial Group, you can go to our website, jpfinancialgroupllc.com. We also host a podcast, the Proactive Women Podcast. We welcome men as well. So that podcast, we will be doing some episodes on the Big Beautiful Bill, the health insurance, as well as the taxes. We also host educational workshops at our location, 5821 Fairview Road. Every month, we have some type of educational financial workshop that is free for individuals to attend. And those dates and times are on the website as well. So I encourage people to become students, be diligent. Call, we can be reached 704-543-6269. I also welcome emails. You can email me, joyce@jpfinancialgroupllc.com. And of course, you can follow us on Facebook, LinkedIn, and Instagram.
I think that about covers it.
I think so. You
Okay.
can get to us anyway, right?
Well, and I'm sure over the next few weeks and months, people will find a way to get to you. And Joyce, thank you so much for joining me for Another Words. And for all of you out there, be sure to go to our website, thecharlottepost.com, become a sponsor, not a sponsor, a donor, which is a sponsorship of sorts,
Yeah.
subscriber, or subscribe to our weekly newsletters, news, health, sports. That's where our action is. And support our work, because bringing journalism to you is free. Creating it is not. So we need everyone's help. And the denomination doesn't matter, big or small. We take them all. And thank you for that. And Joyce, thank you again for joining us. And we'll be sure to reach out to you as time goes on, and that probably before the window opens
Right.
for re-enrollment, because we know you're going to be swamped once
Yes.
it is
Yeah.
open. And so for all of us at the Charlotte Post and Joyce Palmer, I'm Herb White. Thanks for listening and watching.